Hi, my name's Anya and welcome to today's Aspiring Medics video on interpersonal skills. If you're new here and if you enjoyed the video, don't forget to hit like and subscribe.
Describe a situation where you had to provide feedback to a colleague or classmate about a mistake they made. How did you approach the conversation?
So there was a time in my A-level biology class when we were completing one of the required practicals, and I noticed that one of my peers was not inputting the control data correctly. And obviously that's really important for when we go on to do the statistics after and to make sure that our experiment is successful. So first of all, I wanted to make sure that when I commented on this, that it was in a private space and it was in an open, non-confrontational, but instead supportive way. So I took them to the side and I started openly by asking them how they were finding the experiment and if there were any concerns they had or if there was anything they were struggling with that we as the rest of the group could help them with. But they said that they seemed to think that it was all going okay. So therefore I said, I just noticed that I think one of the data points that you'd inputted was incorrect. If we could go over that as a group just to make sure where the mistake has come from. Then I really wanted to initiate like a collaborative environment of making sure that we could all work together to work out where the mistake had come from, to see where the error had come from. Was it just a mistake or was it something that we didn't understand properly? And had some guidance from the teacher there for knowing like when to reach out for help when we weren't quite sure ourselves. So from then on we just realized it was a mistake, and so therefore we brainstormed as a group and I suggested that maybe we should have two members of our group inputting control data as kind of a double check mechanism to make sure that everything was successful, and added that I could help assist a peer who initially got it wrong to go through it step by step and to see if they had any questions. And I think what's really important here is to be really open and be really welcoming as a group. It's not one person's mistake, it's all about working together as a team. So to conclude, this is a really good example of when I had to spot out a mistake and challenge it. And I did this in an open and nice way, and we then collaborated to make sure that the mistake didn't happen again to ensure that our experiment was as successful as possible.
What is your understanding of socioeconomic inequality in healthcare?
My understanding of socioeconomic health inequalities is that there is a disparity across the country from the healthcare that is accessible and healthcare that we receive. And I think these can be as a result of many factors, but I'm going to focus on four main ones which I think are really important. And they are access, education, behaviours and materials. So if we think about the first one with access, everyone has the right to access healthcare, but in some areas of the country it is harder than others. For example, in rural communities where public transport links, getting from villages, coming to a big healthcare tertiary centre which is sometimes needed, is really quite difficult. And this can be also tying into the financial side, maybe of people not being able to afford public transportation if they're having to visit the hospital a lot. But it's also the idea that in certain communities across the country that they do not have such good access to healthcare, whether that be a lack of healthcare community centres or walk-in centres, which could really help. So then I think there's also the education aspect. There are wide varieties of education provisions across the country, and education does play a really big role in healthcare. The education around smoking, around alcohol, around risk factors and lifestyle factors that can contribute. And I think through the lack of education and through the lack of support sometimes throughout people's healthcare journeys, and health literacy. Health literacy really varies across the country again, and helping target and helping support those people who need the extra support I think is sometimes missing from certain areas of the country. I think that also ties into the behaviours factor, which I mentioned earlier, of the behaviours of in certain areas of the country there are more risk factors of lifestyle factors such as smoking, drinking, obesity and and so on that are really important, and again ties in with the education of the real aspect of preventative medicine, I think, is lost due to our socioeconomic healthcare inequalities. And I think another one is materials. I think there are also, again, a wide variety of living standards across the country, and some housing, such as if it's damp, if there's mold, these can cause healthcare problems in of itself. And so by having such a different range of materials available to people can really increase the healthcare inequalities, which is really important to consider as well. I think, to conclude, healthcare inequalities due to socioeconomic factors are really important to understand. I think by putting in education provisions, by maybe audits being completed by hospitals to understand where the access problems are, maybe if there's not a bus route that's available from certain places to hospitals, that they could then target and speak to the councils about. And again, councils really taking the opportunity to understand why there may be socioeconomic factors that are contributing to healthcare inequalities in their specific region that they could target, whether they are education preventative programs or maybe more walk-in centres that are available at community centres. I think there's such a wide variety of things that we can target, but in this example I've just focused on the access, the education, the behaviours and the material reasons. But I think it's really important to ensure that all patients get the most optimum healthcare.
A patient becomes aggressive and upset due to a prolonged wait time. How do you approach and de-escalate the situation?
So, first of all, I want to acknowledge that this could be incredibly frustrating for patients. And so I'd want to approach the situation in a really calm manner. And I think I would start off by asking them the open question and letting them really get their feelings across and get their frustrations across, and make sure I wouldn't interrupt that. I'd do some really active listening. I would be showing my empathy and saying, yeah, I really understand that this can be so frustrating when you've been waiting so long. And I think the first thing I would do is maybe offer an explanation to see if that could help them. Say that we are really struggling with staffing at the moment and there's been a really big increase in patient volume that's coming through the door. That means we are wanting to see patients but we're not being able to see them as quick enough as they deserve, and that maybe, say, if you've got an appointment at 12 and it's 1:30 and you've still not gone in, how frustrating that can be, and really listen to them. And I think then I would really ask them if there's anything specifically we could do. Is it that it's really noisy in the waiting room and it's becoming really frustrating? If there could be another place that they wanted to wait where we could go and fetch them when it's time? Whether it could be that we could reschedule the appointment for another time that's more appropriate and more convenient for them if they have other places to be, if that's why they're even becoming increasingly frustrated. Or maybe just as simple as offering them a refreshment, tea, coffee. Sometimes tea and coffee can really help de-stress people. And I would really just mirror their frustrations and really try and take on board what they're saying and seeing if we can collaborate together to help them. But I think it's important to acknowledge that in some cases, patients, when they become increasingly angry and frustrated, that's important to just keep a distance and ensure that if the situation was to escalate, that we could go to a senior colleague if necessary, or go and contact security if necessary. But I think majority of the time, when you explain to the patients, when you really give them the time to vent their frustrations and try and see if you can come up with a plan to help them, I think most patients will improve and feel much better.
You are a doctor working in A&E. You notice one of the other doctors crying in the staff room. What do you do?
So working in A&E can be sometimes incredibly emotional. You can deal with quite traumatic cases, and sometimes this can all get on top of you. So maybe that could be the reason why they are upset. But I would like to acknowledge to begin with that it could not be that. It could be due to personal reasons. There could be such a wide variety of reasons as to why my colleague could be upset. So what I would want to do is just go really open into the conversation and ask them if they wanted to go and chat in a more private space, and offer them that opportunity to open up and see if that was something that they wanted to discuss. And if that would be, I would, again, like I said, take them into that private space where it's just the two of them and say, look, I saw that you were really upset. I just want you to know that I'm here for you, and is there anything that I can do? And then go from there and see what it was. For example, if it was due to a quite traumatic case that has come in through A&E, and maybe I had also been a part of that we could discuss it together, and that we could go through our emotions and our feelings and our thoughts that happened as a result of that specific case to see if that would help, and also point them to any resources available to the hospital, because I think I understand that there are support mechanisms in place from hospital trusts for when these really upsetting cases can happen, where we can all work together as a team and reflect on that. If it was a more personal case, then I think discussing that with them, and again offering your support as a colleague, as someone that's outside of their personal life, that's more at their work life, to see if it's something that they want to discuss, or if there's anything they wanted me to do or to put in place. I think the most important thing is to just really understand where they're coming from and your actions based off what they're saying to you. Is it appropriate for you to discuss this with them and to offer them that support, or is it that they just want you to acknowledge but just to move on and that they're okay? So I think to conclude, this is obviously an incredibly upsetting time for your colleague, and you would want to offer that support when needed, and if that's what they consent to, but also know when to stand back and just let people have their own personal private space.
During work experience, you notice a patient constantly waiting a long time to be taken to the toilet. How would you take initiative to address their needs?
So I think the first thing to do is really respect the patient's dignity, but also we want to make them as comfortable as possible. So I would maybe approach them in their bed, and I would make sure I draw the curtain for privacy and ensure that they are comfortable in that space. And I would start and say, like, I've noticed that you seem to be in discomfort. Is there something that I can help you with around going to the toilet? And asking them if that's something that they would want. So first of all, consent, and really make sure that they are okay with this discussion. And if they were to say yes, I would then really want to explore the reasons why they were being prevented from going to the toilet, because I think this could be a variety of reasons. This could be due to pain. This could be due to mobility. This could be due to cognitive factors. There are a wide variety of reasons that this could be. And so I'd want to tailor what I would do as a result of that. So I would also have to acknowledge that as I was on work experience, there was not necessarily something clinically that I could do. Whilst I could help them with standing up and maybe walking in more of a supportive role, I would actually go and contact the nurse that is directly looking after the patient to see if it was maybe as a result of pain that we could maybe look at increasing their pain medication. If it's something to do with mobility, is there maybe a walking frame or something that could help them? Or is it that there is, I think I've seen them like urine pots that they could do at the bedside with dignity with a curtain round, which is better for that patient. But I think the most important thing is to notify the person that is looking after that patient, plan in place of how we can stop that from happening again. I think it could also be important to, maybe in this case, if I've seen them for a long period of time saying that they needed to go to the toilet and they've not had any care given to them, to maybe talk to more of a senior nurse and say, I've noticed that this is a repeated pattern with this patient. Maybe we need to alter their records so that there could be more frequent care put in place for this specific patient. Or if it's a staffing issue and they need to be notified of that. So I think overall, in this case, the most important thing is to make sure that the patient has dignity and is comfortable, to try and get down to the reason of why, to then plan appropriately and to notify a senior colleague if you think that this is something that is a concern and needs to have widespread change.
You are a medical student. A patient with rheumatoid arthritis expresses frustration with their treatment plan, ibuprofen, a non-steroidal anti-inflammatory drug. They believe it is ineffective. What would you do?
First of all, I would remain non-judgmental and open to the patient's viewpoint. I think the most important thing to do initially is understand why the patient has that viewpoint. Is it maybe that it used to work and it no longer works, or it only works for a certain amount of hours, and that could maybe suggest that we just need to increase the dose? Or could it be as a result of side effects from the drug? I think I've seen that ibuprofen could sometimes cause like abdominal discomfort, and maybe we need to explore another option for them. Or is it that they just believe that the drug is completely ineffective and they don't want to take it anymore? I think I would start off by talking about evidence-based medicine, that this NSAID is a drug that targets the inflammation which causes the pain that is often associated with the rheumatoid arthritis. But in this particular patient's case, it might not be pain that is their most important symptom to them. So I think understanding the patient's viewpoint and what they would like to get out of treatment is really important. Because for some patients, a more holistic treatment could be more suitable, whether that be a dietitian or any kind of other supports. I think that's really important to consider as well. But I think as a doctor, the most important thing to do is make sure that we're following nice guidelines to ensure that the best treatment is offered for them, to ensure that side effects are under control, or if there's alternative treatments that could be offered. Make sure that the dosage is correct, or explore the more holistic factors, whilst always taking into consideration the patient's viewpoint and helping reach a collaborative decision on what the best treatment forward is to go with.
Explain coronary heart disease as if you were explaining it to a patient with limited health literacy.
So I would start off by explaining that the heart is this really big muscle that pumps blood all around our body, and blood is really important because it supplies the oxygen that we breathe in to our body so that it can work. But in that way, our heart also needs some oxygen. So it has these things called blood vessels on them, which supplies the heart with the oxygen. Now, sometimes these blood vessels can become blocked, and that means that the oxygen can't supply the heart, and we can have symptoms such as breathlessness, shortness of breath, and just general fatigue, which isn't good. Now, if that was good for them and they understood that, then that's great, but I would always want to ask them questions and see if they were following, or maybe using more of an analogy to explain it. For example, you could describe the heart, like I said, as a pump and the blood vessels as pipes. And if the pipes get blocked, then the pump can't function. Something like that. I think it's really about adapting your explanation to the patient that's in front of you. For example, it could be maybe more of a language barrier that is making it hard for the patient to understand about coronary heart disease. So in that case, is it a language line or an interpreter that is more important? Sometimes patients are really big visual learners, and sometimes if I was to draw that out, that might help them. So I think it's really important to give a targeted approach depending on the patient that's in front of you. And once I've described that what coronary heart disease is, I would then ask them if they understood. And then I would explain that there are certain things that we do that can make blockages worse. And these are what we describe as lifestyle factors, and these can be things such as smoking, these can be such as eating unhealthy foods, and explaining that if we cut these out of our diet, blood vessels are less likely to block. So I think most important thing is to always check in with the patient, check that they're understanding, and be open to and non-judgmental to any questions that they might follow with.
You were seeing a patient with worsening inflammatory bowel disease despite steroid medication. You prefer adding stronger immunosuppressive medicine while your colleagues suggest trying surgery. How do you resolve this?
So collaborative teamwork is really important in this example. I think it's important to acknowledge that all of our colleagues have really good insights to offer, and people come from different backgrounds of training that can offer something that maybe you don't necessarily know about. So in this case, I would arrange a time to meet with my colleague to discuss the patient. So what we would want to do is review the patient records and review the evidence basis behind each of the treatments. So in my case, the immunosuppression, but me also understanding more about the surgery that they are wanting to perform. And I think the most important thing is to make sure that it is patient-centered. Both of these treatments are going to have pros and cons, and it's about how does it match our patient. So for example, if we were to go down the surgery route, it would be really important to know, does the patient suffer from other comorbidities? Are they really old and maybe might not recover from the surgery as well? So maybe is surgery less appropriate for this patient in particular? Or on the other hand, immunosuppression could have side effects on them that's going to stop them from doing things that they really enjoy doing, things that they normally do in their daily lives now that would restrict them, and if that's something that's really important to the patient. So I think once we've discussed the evidence basis to know is there one that is particularly better than the other that means we should go down that route, I think the most important thing is to collaborate and understand the patient's viewpoint. Sometimes I think it's even worthwhile having a discussion as a team with the patient to understand what they want from the treatment. What is their aims? What is their expectations? And what treatment would be most suitable for them? So to conclude, I think in this case, it's all about being collaborative, being open and discussing all together to make sure that we are treating the patient in front of us specifically so that they can have the best outcomes.
A patient expresses fear and uncertainty about their upcoming chemotherapy treatment plan. How would you explain the concepts and address their concerns?
Chemotherapy can be a really difficult treatment for patients to undergo, and so it's really important to acknowledge that it's very natural for the patient to feel worried and to feel maybe a bit of fear and uncertainty going into the process. And so I think the most important thing is to have an open conversation with the patient to really understand their fears and their concerns and how we could help them through this process. For example, is it that they maybe don't understand what the chemotherapy does, and then maybe we could explain how it's something that's going to go in and kill all of the cancer cells, and that could either make it easier for a surgery to then be completed, or is it something that happens after a surgery to make sure that we're making sure all the cancer is gone as best we can, or is it a standalone treatment? I think by helping them understand the importance and the effectiveness of the treatment can be really important in some cases. But I think for a lot of patients, the main concern is how it's going to affect their daily lives. Chemotherapy is typically associated with a lot of side effects. These can be hair loss, it can be nausea, it can be general fatigue, and these can be really quite scary for patients. And I think having an open conversation with them about these symptoms that could possibly occur and things that we could put in place from the beginning, whether that be pain medications, is pain something that they're really worried about? Is it making sure to let them know that we do have some anti-nausea medications that we could give on top of the chemotherapy if that's something that they might potentially need in the future? Or there are nurses which are specifically trained to really help patients and guide them through this process. It tends to be quite an overwhelming, really quite scary thing to step into, and having someone that you could personally talk to and personally contact in those times of needs and signposting that to them could be really important. And I think it's really just about trying to alleviate any of those fears for the patient, taking aside that time to talk to them in private, to maybe talk to them for a prolonged period of time if you can offer that, to really help put them at ease and help support them as best as they can. So to conclude, I think it's really important to acknowledge that this is quite common. Chemotherapy is quite a difficult treatment to go through, and the best thing to do is to just target our treatment and our advice specifically to the patient and their needs, and to signpost them to all of the support that is available to them.
During a consultation, a patient appears withdrawn and hesitant to share their symptoms. How would you build rapport to encourage open communication?
It's important to acknowledge that some patients can come in really hesitant and not really willing to share their personal information. That could be maybe because they're really nervous, they're feeling really anxious about coming in. You know, sometimes walking in to see a doctor can be really quite a scary thing for some people. Or it could be that they're maybe embarrassed or shamed about something that they're going to talk about. I think there's a wide variety of reasons why patients could feel this way. So the most important thing as the doctor is to have a really open, welcoming environment. And I would first of all start off by letting them talk and letting them get across anything that they wanted to. And maybe sometimes signpost if it is necessarily a sensitive topic of conversation, and say, like, what I'm about to ask you or what we're about to discuss can sometimes be really difficult to talk about, but I want you to know that this is a private and confidential safe space for you, and that any information that you share is not going to leave this room. I think sometimes giving that reassurance to patients and reminding them that this is a non-judgmental, open zone for them to share any of their concerns is really important. I think I would really want to reflect and mirror their kind of language and their body language to make them feel as at ease as I can. And maybe start off with the open questions, and if you think there's something that they're not revealing or something that you think is really important, you could then maybe go down more of the direct questioning, or saying, oh yes, could you maybe tell me a little bit more about that, if that's okay. So I think overall the most important thing is to have an open, non-judgmental environment, to maybe signpost when difficult conversations are about to happen, reiterate how it's a confidential, safe space, and allow them to have any questions and explore any of their concerns.